Thank you, Dr. Oommen, for joining us. Today, again, our presenter is Dr. Oommen from UPMC Pinnacle, and I'm going to turn it over to you, Dr. Oommen. Thanks so much.
Okay, thank you for inviting me and for taking the time to listen. I thought I'd talk about a couple of things regarding epilepsy, special type of epilepsy called reflex epilepsies, and also just discuss some of the common triggers that can trigger some seizures in a lot of epilepsy patients. All right, so outline, we may or may not cover all this depending on time. So the first part is, again, this special class of epilepsies called reflex epilepsies, and I'll discuss what that means exactly and their various interesting types. And we'll go over just a few of those. There are many types, which are all pretty rare, but I'll discuss some of the common ones that, that are talked about. And then broadening the topic a little bit about just common things that are precipitants or situations that may trigger seizures in a lot of folks with epilepsy. And some folks experience this more than others, different ones here. And I'll just go quickly over some of these, and then I'd like to have enough time to discuss, have questions or open up to discussion. All right, so let's talk about reflex epilepsy. So this is a particular group of epilepsy conditions or seizure disorders in which the seizures or the other manifestations of the seizure are triggered by both external stimulus or even sort of internal mental processes, or a bit of both. So I'll give you some examples. So these are, sounds or music or things that can definitely trigger some type of seizure-like episode in patients pretty reliably. And we're distinguishing this from, again, the more common things that can trigger or make seizures more likely in the broader epilepsy population. And these are things like sleep deprivation, stress, alcohol, menstrual period, and some other things. And again, that'll be the later part of my talk. In terms of this particular class of reflex epilepsies, it's fairly uncommon. So maybe around 5% of all patients with epilepsy may have a type of reflex epilepsy. But that reflex epilepsy group may be higher in those who have this type of genetic epilepsies. So maybe up to 20% of patients in those with this idiopathic generalized epilepsy, or what's now known more as for genetic epilepsies. So overall, not the most common thing you'll encounter, but it's not, it does happen. And so the most common type of trigger for reflex epilepsies is something to do with light and flashing lights. And I'll just, I love YouTube. I will show a little clip here, and some of you have probably heard about this before.
An investigation is underway in Japan into why more than 600 children suffered from convulsions and vomiting after watching a television cartoon program. It's thought that bright flashing lights in the cartoon, Pocket Monsters, were to blame. Andrew Burrows reports.
Almost every Japanese child knows Pocket Monsters and its star, Pakucho. They play the Nintendo computer game. They even sing the Pocket Monsters song. Millions were glued to the latest cartoon episode when a flashing explosion created from these slowed down images triggered convulsions in hundreds of children. Many were kept in hospital for over 24 hours. Often those affected had no history of epilepsy. More children had fits when excerpts were replayed on the news. Doctors said victims were shocked into a kind of hypnotic trance. Parents are alarmed.
I always thought it was a cute program that was fine for kids, but now I have to be careful about everything they watch.
It's not only cartoons. Fits have been linked with computer games in isolated cases in Japan and Britain.
1 child in 200 in this age group of 5 to 20 is what's called photosensitive. And that means that if a child is photosensitive, flashing lights at a certain rate, most commonly between 10 and 20 flashes per second, may precipitate an epileptic seizure.
Eat this, watch this, Louis, kick it.
British television applies regulations to weed out dangerous flicker, typically caused by rapid contrasts, black on white, white on black.
The BBC and the British television industry as a whole have actually known about this problem for a number of years, and we have detailed guidelines and give advice, technical advice to program makers so that they can avoid these problems when they're making programs. And we obviously screen our programs in advance, and I myself have viewed programs and we've taken shots out where we think there might be a danger of triggering photosensitive epilepsy.
While television screens are carefully monitored, there's no system for regulating computer.
Okay, so this was, that news story is from 1997 when this, there was a whole event of a lot of kids, over 700 kids, as I said, who went to the emergency room with seizures after watching an episode of Pokemon. So this group of, this light-triggered epilepsy, reflex epilepsy, is called photosensitive epilepsy. And this is the sort of this visual type of trigger. Reflex epilepsy is the most common type of reflex epilepsy. You heard the doc on the video say about 1 in 200, roughly 5% of patients with genetic epilepsies may have this condition as part of their as a part of their seizure disorder. It is more common in adolescents and women. It can trigger both sort of big convulsive seizures or maybe just little myoclonus, quick jerking movements of the eyes or the upper body or limbs, sometimes just a staring spell. Some people have, they describe something where they kind of even get kind of drawn towards the image. And rarely focal, that is sort of partial seizures, or seizures just affect one part of the brain. Things that may be more likely to provoke a seizure, the visual, the characteristics of the visual stimulus, the brighter the light and more prolonged exposure to it. You mentioned, the doc mentioned sort of a flash frequency of between, here I said I wrote 15 to 25, he said 10 to 20, so in that range, flashes per second. And visual stimulus that includes more red light rather than blue or white lights are more likely to trigger a seizure. And I think that clip mentioned things like high contrast. So complex pictures which flash brightly and in a certain frequency involving more red colors may be more likely to trigger some type of reflex seizure-like response. I've heard of one patient who told me that even if they're driving in a car, a passenger in a car, and they're going down an avenue with trees, which are regularly spaced and just that the sunlight flickering past in between those things could be enough to trigger some, they just feel a little bit irritated or something about it irritates them. So there's something about that repetitive quality, the brightness of it. Some mitigation efforts one can do is, when watching a TV or a screen, place it a little bit further away, place in a bright room so it's not the only bright object in the room that you're watching. And then, certain other conditions. So if you're tired or sleep deprived or fatigued, that may be more likely for that visual stimulus to provoke a seizure. And if you're in that situation where you're somewhere and you have a photosensitive epilepsy and you're suddenly in a situation where things are flashing at you, what can you do? One option is to close one eye. So basically reducing the input, so to speak, of the signal that's getting to your brain by closing one eye or wearing polarized lenses may just cut the amount of light reaching your eyes and hence the signal reaching to the brain. Obviously, in some patients who have not just seizures triggered by visual stimulus, but seizures that are triggered otherwise may need to be on anti-seizure medication. There are some folks who just have seizures triggered by visual stimulus and nothing else. There are also some folks who, if you did an EEG on them, you find some patterns that are provoked on the EEG by visual stimulus. So patients who've had EEGs, you remember they'll flash these lights at you at this sort of sequence from about 1 flash per second or 2 flashes per second up to about 20, and we're looking for that rare folks who may have a response, an abnormal visual electrical response to the brain. Turns out maybe like 1% of patients may just have just that phenomenon alone on EEG, but they've never had a seizure. They've never had a visual evoked seizure at all. So that's quite interesting. In those cases, I don't think they need to be on seizure medication. And moving on, this is much rarer, but pretty interesting. So I've never come across this, although I've had patients who have definitely told me that when they are concentrating or thinking, they seem to provoke like maybe a seizure aura or some change that they perceive as a possible seizure. And this is at least reported in the literature to be rather rare, but they can be seizures triggered by specific cognitive functions. So for example, for somebody might be calculation, planning, making a decision, certain types of things that, some types of thinking behaviors. I read a case report while presenting this presentation, reading about this presentation about somebody who would have a seizure every time he lied about something related to his business. So, so they call that like a Pinocchio syndrome. So very interesting. It's not just simple thinking, but specific thoughts. And so that's pretty interesting thinking about in terms of how seizures are generated. What happens with seizures suggests that there's certain parts of the brain, certain functions of the brain that are involved in generating those things. And the types of seizures may just be, again, like those typical jerks or myoclonic movements, or just a brief staring off spell, or maybe a more generalized seizure. Again, that's much less frequent, maybe more common in some of those genetic epilepsies, like a juvenile myoclonic epilepsy, for example. Certainly a patient with juvenile myoclonic epilepsy will tell me that sometimes they're just kind of concentrating or thinking on something and they feel like they blip out for a moment. But I also have heard this in a couple of patients with like maybe some type of focal epilepsy, like a mesiotemporal lobe epilepsy. Musicogenic epilepsy. So let me give you another clip here. Okay, let's try that again.
My name's Reflex, and I'm epileptic. I had my first seizure on New Year's Day 2008. I've been poorly all over Christmas, but then I had to go to hospital because I couldn't take it anymore. I had my first tonic-clonic seizure. I got discharged and carried on, and it took quite a while for me to get a diagnosis, but in the end I did get a diagnosis that I was epileptic. As the years progressed, my epilepsy got worse. And however, I heard some music and it was Neo. And every time I heard this song, Give Me Everything, it made me have a seizure, which I thought was very, very bizarre. And as he released more songs, I had more seizures. So I had to tell my consultant that I was having seizures to the singer Neo, which the doctors were fascinated by and had to prove that it was right. So I had to go into hospital, put electrodes all on the outside of my brain, and have the music played to me, video recorded, and they obviously saw that I went into a seizure. However, saying that, they also had to put electrodes on the inside of my brain, around each temporal lobe, and played music to me. And when they did that, they saw that my music seizures were actually on the right-hand side of my brain, whereas my epilepsy, my mesial-temporal sclerosis, was on the left-hand side of my brain. So it turns out I've got epilepsy in both sides of my brain. I have had brain surgery in June this year. They've taken away most of my left temporal lobe, but I'm still left with the right, and I'm still left with the singer Neo causing my seizures, and I will be forever.
Doesn't sound like she's too thrilled about having Neo cause her seizures. I'm not really familiar with that artist. But sorry for the YouTube distraction there. So that's a pretty interesting case. So musicogenic epilepsy, rare, 1 in 10 million. So seizure triggered by listening to music. And again, it's a very specific category for every person. It's going to be a little bit different, but it's not a simple sound. It is maybe a specific composer or musician, like it is in that case, because she said it was not just a single song by that artist that provoked seizures, but a lot of the songs by that artist that provoked the seizures. So, or the composer, or the type of music, or an instrument. And again, I read about somebody who had a seizure, who had this type of sort of like this musicogenic reflex seizures when she listened to a certain type of music. And then one day out of the blue, she had a seizure in her sleep, which usually didn't happen. And what she recalled was that she was having a dream in which she was listening to that music that triggers her seizures. So again, it's pretty fascinating. Gives you a little bit of a window of how complex the brain is, and so, you know, it suggests a little bit about how these seizures may be generated. And so again, the story here is that it's actually a pretty complex stimulus, musical stimulus, that will trigger this. So get rid of all the. All right, whoops. All right, and one more comment about seizures. So this is hot water or bathing epilepsy. So this is a new one. I never heard of this one until I read about it. So this is a seizure, usually a focal seizure, that is triggered by bathing in hot water. So it has to be pretty hot, and, you know, pouring that water over your head. And so again, a pretty complex, specific stimulus. And what I read about this one is that people often like it. So they'll actually, you know, they don't mind this seizure happening. I guess, of course, unless it's a convulsive seizure where they fall or injure themselves. It's rather rare, but interestingly, it's reported with higher incidence in southern India, which was interesting to me because that is where my family is from. And so when the authors were describing this and surmising on why this might be the case, obviously there's probably some genetic component to this. So there's some genes that are prevalent in that population that may be involved, likely a necessary factor in triggering this type of seizure. But they also commented on certain, you know, cultural practices, particularly, you know, the cultural practice of bathing with very hot water. Now, I don't know if that cultural practice is just from southern India. That, whoops, can you hear me? I think I heard I'm muted. Whoops.
We can hear you now.
Okay, all right, yeah. As I was saying, so this this thing with this triggers triggered by hot water, and they were surmising that there's a cultural practice of folks bathing with hot water in southern India, and I can't attest for everyone in South India, but I can attest that my mom especially likes to bathe with very hot water even in the summertime, and so maybe that is a cultural practice down there. And so there are some other ones, other types of ones which, so there are some patients have reflex epilepsies which are triggered by certain types of touch. So rubbing the skin or certain types of textures that can trigger a seizure. There's one called reading epilepsy, which I think I've come across this once, in where people will start to read and have like a myoclonic jerk. Typically might again be like they describe like a jaw myoclonus. And in my experience, I was alerted to this young fellow who came in for EEG, and he told the technician that the only time he's ever had a seizure is when he reads something. And the technician was rather clever and said, okay, let's try that. So after the usual hyperventilation and photic stimulation, she gave him some boring book to read. And sure enough, he started to read this book, and it wasn't just a simple sentence. It was kind of, he's going into a paragraph, and he starts to have this kind of sort of a shake, and he doesn't have a seizure, but he starts to have these quick jerking movements, and in fact, because those jerking movements make it a little bit hard to interpret the EEG at times, I was rather skeptical until I did some more EEG, and so in fact, he had a seizure later on during another EEG with photic stimulation. So he, in that reading epilepsy, they say it's usually triggered by some type of focal epilepsy, although in his case, I think he had more of a genetic epilepsy, like juvenile myoclonic epilepsy. Okay, so very interesting, again, not common, but is out there. So if somebody tells you a story about certain things that might trigger a seizure, I would pay attention. I'll just tell you that as I've done this more and more, and I see more patients with epilepsy, you just hear the weirdest stories. But initially, I'd be a little bit dismissive or rather skeptical about the stories I would hear about things that might trigger seizures. But more and more, the weirder the story, the more I'm interested in knowing, or the more I'm open-minded into figuring out that, hey, that might actually be a seizure disorder. So there's always new things to encounter. Let's talk then about some of the other things that can trigger seizures here. So I'm going to move into some of the more common seizure triggers that are relevant to more patients with epilepsy. So probably the most common reported seizure precipitant is stress. Just about every patient I meet, when I ask them, what makes your seizures more likely, will report stress in some way. And this is pretty common. And patients report that stress in some way can make seizures more likely, and also that stress, and other things. So if they say, look, stress is something that can cause seizures, they often also report having had problems with mood disorders such as anxiety or depression or some history of childhood trauma. Now, people have investigated, is there like a clear biological connection between stress and epilepsy? And I would say that there is probably not like a direct line between an increased level of stress and definitely triggering a seizure. But we do know that there's several stress responses that we have depending on the type of stress, the chronicity of the stress, the stressful event, how severe it was. It triggers certain release of hormones of different types, and those hormones have excitatory effects on the brain. So the link probably is a little bit more complex than a simple one-to-one causation. And I mean, the studies have tried to piece this apart, but as you can imagine, it's a little bit hard to pin down the details, just because stress can be described and manifested in so many ways. It's hard to probably kind of collect enough information about a particular type of stress trigger. But the other thing, and when people study, okay, let's try some techniques to manage your stress, and a lot of patients have their own ways of doing this. Deep breathing, counseling, exercise, and all sorts of other things that people use, both maybe with counselors or with groups or just self-management, that these stress reductions do improve their seizures or their outcomes, their kind of quality of life. When they've looked into whether this actually reduces the number of seizures, it's that the tying is not as clear. But I think it's important enough that the message to physicians, which I think most epilepsy docs and most neurologists who treat epilepsy patients probably know, is that, if there's stress, screen for mood or ask about mood and anxiety disorders, because even if the stress is not a trigger, stress is just sort of anxiety and depression are just often go along with having epilepsy. And so it's important for us to address those factors and figure out the best way to treat those conditions as well. And we'll probably have more to talk about that later. The other probably is very common precipitant is sleep. So I often tell patients that, you need to get adequate sleep. Your neurologist probably tells you this as well, that, a regular sleep cycle is very important. Shift workers or people who have irregular shifts night and day, I think they have a lot of issues sometimes with controlling their seizure, and probably multifactorial. But sleep deprivation, or people will, have a seizure and they'll look back and say, you know what, I've been stressed or I've been getting less sleep for the last couple of days. This is particularly the case in patients with some of these genetic epilepsies like juvenile myoclonic epilepsy. So not uncommon scenario for diagnosis of somebody with juvenile myoclonic epilepsy is in somebody who just is first time in college, and they're in a month or two into their course, and they've had some long nights either partying or staying up to finish projects or papers or both, and they have a first-time seizure, and eventually leads to that diagnosis. So clearly then sleep deprivation is a strong trigger, and I find that in patients, a lot of my patients with juvenile myoclonic epilepsy, that's certainly a strong trigger, even those who are on seizure medication. So they tend to just enough sleep deprivation can trigger some seizures in those folks. And so sometimes it's a combination of not just medication management, but being very careful about the sleep and quality of sleep. In fact, in some patients with JME who I know have a really strong seizure trigger, I tend to ask them to keep some Ativan and maybe take some Ativan if like they've had a long night and they didn't get sleep that night, because they're so likely to have a seizure and I want to try and head it off. Also in patients with those kind of genetic epilepsies, they tend to report that their seizures are more likely to occur in the early mornings or upon awakening or soon after. For some seizures people, that's not often the case, but there seems to be an association in patients with genetic epilepsies with that sort of sleep transition from sleep to wake. Whereas patients with some types of other types of focal epilepsies may tend to have seizures more in their sleep. So some types of frontal lobe epilepsies, for example, are more likely to occur when they in the setting of sleep deprivation. And this is if somebody's had experience with an epilepsy monitoring unit. When you go to the epilepsy monitoring unit, we're trying to trigger seizures to see where the seizures are coming from. And one of the very sensitive techniques we use is sleep deprivation. So we have people stay up about every other night till the wee hours of the morning and have them limit their naps during the day, just to kind of really fragment their sleep and make it more likely that they might have a seizure. All right. And there's a particular phenomenon called catamenial epilepsy. So this is in women with epilepsy, and occurs in about 30% of patients of women with epilepsy. And this is where they notice seizure clusters during certain portions of their menstrual period. And there are three patterns to this: C1, C2, and C3 as shown on the table. C1 is actually just prior to or the beginning part of their menstrual period. And they tend to have increased seizures right at the beginning or just before it, and that relates to a drop in the progesterone level that occurs when menstrual period starts. The second phase, another pattern is called C2, and this is around ovulation, so about 14 days prior to the onset of menses, and this is where during ovulation there's a rise in estrogen that triggers ovulation, and estrogen is thought to be a sort of an excitatory hormone that it kind of makes neurons a little bit more active, and that may be a reason why there's an increase in seizures during the ovulatory period. And then the last phase is during the sort of the late, sort of early part of the cycle, where again, there's a rising estrogen level in preparation for ovulation. And again, we're linked to the fact that estrogen may be sort of a bit of an excitatory hormone. So other things, alcohol and marijuana, a lot of questions about marijuana, especially these days. I think alcohol, this is a common question among folks, especially folks, younger folks in their early 20s or so, who ask about alcohol and is it safe to drink alcohol either in combination with their medications or will it precipitate seizures? So I think overall, I think most epileptologists will agree that sort of a small amount, that is a standard 1 to 2 drinks of alcohol, is probably not going to provoke a seizure or really affect your drug levels. With one exception, again, and this is in patients with genetic epilepsy, such as juvenile myoclonic epilepsy. And in some folks with juvenile myoclonic epilepsy, they're rather sensitive to alcohol, and often about 24 hours after their consumption of alcohol. So I tell folks that, look, I think you're probably safe to do so, but if it seems to be a consistent pattern, or if you have a seizure around the time you drink alcohol, then you might want to avoid it. This is the sort of another aspect of this is that we do know that alcohol withdrawal can reduce your seizure threshold. So alcohol kind of acts on the receptors in the brain the same way medications like Ativan or clonazepam do, and the withdrawal of alcohol in certain situations, so either perhaps after sort of heavy binge drinking, or those who chronically drink alcohol and are suddenly not able to continue drinking within the first few days, are likely to may have a withdrawal seizure. And sometimes when people have a seizure just in that setting, or the first time a seizure is and it's in the setting of alcohol withdrawal, the question is, do they have epilepsy that is a seizure disorder, or is that just because of alcohol withdrawal? And sometimes it's hard to tell, and time only can tell. The other questions about marijuana, both recreational and medicinal marijuana. And I think that your patient's experience varies. We do know, for example, now that the CBD compounds in marijuana are protective against seizures. In fact, we all know about now the medication Epidiolex, which is a FDA-approved medication for treatment of drug-resistant epilepsy in children. So that is a pure, concentrated medication of just the CBD, which tends to have anticonvulsant effects. I tell patients who use marijuana that, again, your results may vary. Marijuana has some anti-epileptic compounds like CBD, but even medical marijuana are going to have some pro-convulsant compounds as well. So your experience may vary just depending on the strain or type of marijuana you use and the amount. And I think for some patients, they tell me that it may or may not help their seizures. It may or may not help their stress. And for some people, it may have no effect. And some people, it may actually increase their seizures. So I think it's something that if one is using that, to just have a careful kind of track of what the use is and how it may correlate to seizures. And this is an ongoing area of investigation. I talked earlier about mood and anxiety disorders being very common in patients with epilepsy. So the question is it safe to take one of these medications if your primary care doctor provides, let's say, a medication for anxiety or depression? Are they safe to use in someone with epilepsy? So in general, even though a lot of the medications may have a warning when you read about it that this may trigger seizures, I think our experience overall is that they're fairly safe to use, and I prescribe these kinds of medications fairly regularly in patients with epilepsy if it's indicated, and used in the usual amounts are safe to use. Seizures have been reported in some of these things, tend to be more likely in those who are on very high doses or those who may have overdosed on it. The one medication that's used commonly in the United States that we do avoid in patients with epilepsy is bupropion or Wellbutrin, which is known to reduce seizure threshold. That said, I have made exceptions in certain patients who have epilepsy, which I've okayed the use of Wellbutrin if that's the only thing that's really helped them with their mood or anxiety disorder. And so, I mean, it's a risk-benefit analysis. I mean, do you want to be miserable and not have seizures, or take a small risk and be well overall with the right medication. And so far, I've not had a terribly bad experience with that. Other things, this is mostly antibiotic use, mostly in the setting of antibiotics that are used like in IV settings in the hospital when one is really sick. And these are usually in patients who may or may not have epilepsy, but they're rather sick with renal failure, and we're doing like sort of like these advanced 4th generation antibiotics that in IV doses, and we tend to notice that they might have seizures, which are not obvious when you examine them because they may be sick and comatose, but if you put an EEG on, you would see patterns that look like seizures. For most medications that you're kind of prescribed by your family doctor for your sore throat or things like that, things like amoxicillin, those things are perfectly safe. I do want to mention over-the-counter medications, so some of you have probably heard about these before. So diphenhydramine, that is Benadryl, or in some of these compounds like Tylenol PM, or some of the cold medications that help you sleep, they often contain diphenhydramine or Benadryl. And Benadryl can lower seizure threshold in some folks. Probably that's a dose-dependent effect as well, but that's something to know about. What about some of the other ingredients in common cold medications? It's questioned. I mean, there are reports of dextromethorphan. This is a decongestant that's used in a lot of these cold medications. I think toxicity from DEC, so some people do abuse this, and in those very high dose, overdose toxic uses, it can trigger seizures. Pseudoephedrine, I think it's fairly safe to use, although there are some reports about it triggering seizures as well. And there may be some other medications you've heard about. Okay, with that, I'm going to stop my spiel, and I will entertain any questions.
Thank you, Dr. Oommen.